That's it, guys. We finished this group of muscles. Now let's describe what are the surface anatomy landmarks, what are the things, the parts of some bones, some muscles that we can see through the skin or we can palpate through the skin. Let's describe those just in the parts in the thorax and upper limbs, only in the legs. So we're gonna use that model to describe these surface anatomy landmarks. So pectoralis major muscle. Well, you know where it's located, right? So here we can see the pectoralis major muscle. In him is all of this muscle in here. So one landmark gone. In here you can see the slips of the serratus anterior. So this is serratus, this is pectoralis major. We'll go there later. See, the pectoralis major creates a groove when it inserts or originates here in the clavicle. This we can see here. This is the clavicle, and then we have here the origin of the deltoid. Here is the deltoid. Pectoralis major, clavicle, and here we always have like a little triangular fossa that is the groove between the insertions or the attachments on the clavicle of the pectoralis major and the deltoid muscle. Deltoid muscle, since is a very thick, powerful muscle, is usually used to pinch it to apply injections. Now, the part of the abdomen and the rest of the muscular parts, I think we described that in the previous last week. Now, the axilla. The axilla is like a pyramid, so shaped like that. It has the base is just where the hair is, and then you have two walls or two columns of muscle. See, so like where the hair is like a valley, and we have this mountain and another mountain. Okay, so this anterior fold, and you can grab it like this, please do. That's the anterior axillary fold and consists of the pectoralis major. When you grab the posterior axillary fold, consists of this is the latissimus dorsi, and this is the teres major muscle. What else can we see? Clavicle, the acromioclavicular joint. Just feel, you can see the clavicle in here, feel it laterally, okay? And then move anteriorly, flex your arm, okay? Flex and extend your arm, and then you can feel the acromioclavicular joint moving. That's the point where the acromioclavicular joint is located. Now, the humerus can be palpated, the medial and the lateral side can be palpated all the way in your arm. Now, another landmarks that we can palpate on the humerus is this is the greater tubercle of the humerus. It's the most superficial bump in here that you can feel rounded. That's the greater tubercle. Like about 3, depending on the fingers, but 3 or 4 fingers inferior to that is where we apply deltoid injections. What else? Okay, distally, you can palpate on the humerus, touch it like that at the elbow, and you will feel the lateral and the medial epicondyles. So we're going to use it next class to describe the muscles of the forearm. What else? Yes, done. Biceps. Well, I think it's better in another slide. Okay, in here, again, we can see, this is cool because we can see in the arm how the bones project. So the parts that you can feel the clavicle. This is the acromioclavicular joint. You can feel the greater tubercle. you can feel all of these medial. Let me grab another color. I don't think it's doing. Okay, all the anterior, medial aspect of the humerus and the lateral aspect can be felt through the skin. These are the epicondyles. You can feel it on your elbow. This is the lateral and this is the medial epicondyle. Places where if it hurts, well, you just diagnosed epicondylitis. What else? What else here? Well, the distal part, we're gonna leave it for next class. In here, well, you can see, and I want you to do that. Okay, better picture to see the axillary folds. This is the base of the axilla. This is the anterior axillary fold, pectoralis major, and that is the posterior axillary fold, latissimus dorsi and teres major. Here you can see the pectoralis major. And here you can see the insertion of the deltoid. The entire deltoid. Now, look at here is the deltoid again. Okay, and let me grab another color in blue. I'm going to show you the biceps. Okay, and I think it's an easy, everybody knows where the biceps is, right? Now I want you to do that. Show me your biceps. Show it to me. Show it. Okay, touch it, contract it, right? When you flex the arm, but flex it. And now perform pronation. Pronate your forearm because now your hand is supinated, right? And your muscle, your biceps brachii is contracted. Can you feel it? Now pronate your forearm and tell me what happens to this. Oh, what's going on? Biceps brachii, like it relaxes when we when we pronate the forearm. See? Told you, biceps brachii, two main functions is to perform elbow flexion at the elbow, and supination of the hand, okay, of the forearm, Now, look in here, this groove where is, that marks like the medial side of the biceps, that is called, feel it like in here, this is called the bicipital groove. Importance about this is that in there, you're gonna find the brachial plexus, the brachial artery, the brachial pulse, okay? So you can push a little bit the muscle and then you're gonna feel the brachial pulse. What else? Well, and down here we have triceps group. There is better seen in here. Now look in here, we can see, whoa, cool, anterior deltoid, the medial fibers of the deltoid, and the posterior fibers of the deltoid. All of this is the posterior fibers of the deltoid. Cool, right? Now again, biceps brachii, and here we can see this is the triceps brachii. Seems like it's the long head. Now, I think I have a better picture to show you the other structures. Lateral view. What we can see in the lateral view? Well, like I think in here we can use black, right? So again, pectoralis major, deltoid muscle, okay? This, look how cool, that's the lateral head of the triceps brachii. Long head is longer, so it's more superior, the ones that goes all the way to the shoulder. This is the tendon of the triceps brachii, and this is right here is the ulna, okay? This is your lateral epicondyle, and the other side is the medial epicondyle. Biceps brachii is right in here, okay? They put in here brachialis. If he was better developed, he's not helping me with my explanations. This is the biceps brachii. This is the triceps in this area, well, we can, yeah, we can see it got dude, but you have to work out a little bit more. This in here is the brachialis, okay? Brachioradialis is when you put your forearm in this position, is the muscle that stands up here, okay? So this column, this muscle is the brachioradialis, okay? Flexor of the arm, don't let it trick you. This is, it behaves like a woman. It will trick you, okay? It's a flexor, but it's innervated by the by the radial nerve. Okay, let's see what structures can we see in here. Let's put green for fun. Okay, so what is this pointing at? You know, all of these, well, these guys have been working out. See, all of this is your, or his, trapezius. Mine is not like that. These are the superior fibers, these are the middle fibers, and these are the inferior fibers of the trapezius. More muscles, the deltoid again, and this is triceps brachii. Erector, we already described that. More muscles around. Yes, I have one more muscle in here. This is the teres major. Okay, when you contract and you can kind of feel it. And all of this is latissimus dorsi. Trapezius. Okay, let's see the bony parts. Let's see if we can do this color-coded. Okay, bony parts. What we can feel, well, remember up here we can see the occipital protuberance. This is C7 or vertebra prominence, which I have, look at that. You can see it here, the occipital protuberance, and the ones that sticks out the most when you flex your neck, that's C7. That's vertebrae prominence. And then you can start counting from there down, okay? So you identify C7, the following one is the spinous process of T1, T2, T3, and T4. You can feel T4. Let me get this guy out. Okay. We were using red. Just like with a sternal angle, you used to identify the second rib, identify C7, and from counting down to count ribs. And in here, spinous processes. Okay, what else? Look at the, well, 2, you keep counting. Remember, well, more spinous processes at the level of the iliac crest. Okay, when you place your hands, remember you can feel your iliac crest, and when you trace a line from the most superior portion of the iliac crest, the line is called the supracristal line and intersects or passes through L4, and this is a very important landmark too, because that's where the spinal taps are performed. Dimples, he doesn't have the dimples, but remember we can find the dimples marking the place of the sacroiliac joint. More bony parts, the ones related to this chapter, right? So scapula, see it projected in the skin. So what can you feel? You can feel the spine of the scapula. Go and feel it right now. Touch the scapula. Oh, that feels good. Now follow it laterally and you will find the acromion. Okay? Keep following and then you reach again the acromioclavicular joint. This is the medial border of the scapula. Sometimes can be felt, okay, sometimes it can't, depending on some muscles insertions that varies from individual to individual. Mine, I can feel it perfectly. Okay, you can perform this movement and you will, like trying to scratch your back, and you will, the middle border will lift for you. We can actually feel and palpate very well the inferior angle of the scapula. Now, the inferior angle of the scapula, and I'm gonna put this in magenta. The inferior angle of the scapula and the medial border of the scapula. the latissimus dorsi, and I'm sorry, the trapezius medially and the latissimus dorsi inferiorly. See, draw this triangle. We call that the triangle of auscultation because that's one of the places where we place the stethoscope to hear. Let me rephrase that. This is where the long sounds are heard the best because in here I don't have bone or muscles, big muscles, um, interfering with the perception of sound. But actually, you place the stethoscope all in the entire back, okay? But it's heard best here in the triangle of auscultation. Um, what else am I missing? Remember this groove in the midline is called the posterior median furrow. I think I'm done. Let's move to the next slide. In here, we can see better now the triceps, okay? So what is the head of the triceps that goes all the way to the shoulder? This one, okay? This is the long head. Inferior to that, you're going to see the medial head. And lateral to that, you're going to see the lateral head, okay? And, well, the tendon will be around here. You can usually feel it inserting into the olecranon. And the olecranon, remember, the funny bone, you know, it's not a funny bone, it's the ulnar nerve that passes very superficial in the medial epicondyle, superficial to the medial epicondyle. And you can hit it and, well, you know the sensation it creates. Have we described everything, guys? I think so. We finished this group of muscles, all the surface anatomy landmarks. See you next week. We're going to cover now the muscles of the forearm, the ones that are, you know, we're marionettes. So now these are the ones that are going to move the wrist and the fingers. See you later, alligators.